You can't access harm reduction services. You're obviously going to be left to your own devices. And in today's crisis, I mean, that's sadly life-ending.
BC's Mental Health and Addictions Ministry didn't do enough to properly implement harm reduction and safe supply programs, according to a government audit. Those programs cover publicly funded overdose prevention sites like this one in Vancouver's Yaletown neighborhood, and prescription drug alternatives for people with substance use disorders. And these programs were put in place in response to BC's toxic, unregulated drug crisis, which has killed about 14,000 people in the province since BC declared a public health emergency in 2016. Auditor General Michael Pickup's report says the ministry's programs lacked consultation, service standards, and its own information on overdose prevention failed to keep up with changing toxic drug supply.
One of the points coming out of this audit is these two ministries need to work more effectively with partners to overcome the barriers, overcome the challenges, and that is what we are not seeing.
Pickup put forward 7 recommendations for the ministry to fix their shortcomings, including creating an action plan to address barriers to harm reduction services, which the report says are not widespread enough in BC.
OPSs and prescribed safer supply services. And we do have a government that's empowered that supports both of those services. However, what we don't have is municipalities that support accessing those services in their communities.
Recently, the Richmond community pushed back against a proposed overdose prevention site at its hospital. The Ministry of Mental Health and Addiction said Minister Jennifer Whiteside was unavailable for an interview, but in a statement she says she acknowledges the, quote, persistent barriers in making these programs work, and the ministry fully accepts all of the recommendations. Premier David Eby commented on the report at a press conference Tuesday.
Our metric of success is driving down the number of deaths that we're seeing. My belief is that we need to dramatically increase the availability of treatment and drop the barriers.
But the deaths are not going down. Last year, the BC Coroner Service recorded 2,511 drug poisoning deaths, the most ever reported in a year. Pickup's report also comes in the wake of recent drug busts in BC, where police misleadingly suggested prescription safe supply was getting resold on the street despite a lack of evidence, and as politicians and pundits attack the province's safe supply program.
The sad part of all of it is that a lot of the politics behind it is that people are talking more about the response to the toxic drug supply, which isn't killing anybody, to not talking about what is killing people, the toxic drug supply.
In Vancouver, Kier Junos, City News.